Hi, my name is Taylor Slocum, and I am a career counselor with Columbus State Community College in the Career Services Department. I also coordinate the Career Mentorship Program as well, which is where the idea for the Meet the Mentor series began. Basically, we just have so many mentors that we want to be able to share as much information with as many students as we can through different live stream opportunities as well as videos such as this one. This Meet the Mentor will be with an X-Ray Technologist. His name is Jacob Slocum, who works with Ohio Health, and if the last name does sound familiar, it is my husband, so it's extra special to have him participate today. He will be providing an overview of his career, of what got him into the career, as well as just a little bit of the overview of the medical imaging program. As an alumni, he serves as a career mentor as well as a host with our other exploration programs, and he really loves to give back to the students, so I'm happy that he'll be answering some questions that were submitted by you today. So let's get started.
Hi, my name is Jacob Slocum. I graduated from Columbus State in 2016 with my associate's degree in medical imaging. I'm currently a senior radiologic technologist at Ohio Health Riverside Methodist Hospital, where I've been working for the past 4 years. I volunteer as a career mentor and a career conversations host with the Career Services Department at Columbus State, and I'm here today to help answer some questions about the medical imaging field. I first became interested in medical imaging when I was in high school. I had a short hospital stay that involved a few trips to the X-ray department, and I was instantly hooked with the science of X-ray and the equipment that was being used. And shortly thereafter, I found that Columbus State offered the associate's degree program in medical imaging, and I signed up as soon as I could so that I could learn more about the profession and hopefully get the clinical hands-on experience to see if that profession really would be for me. The great thing about an associate's degree in medical imaging is it opens the door to a few other professions that fall under the umbrella of radiology. You can walk directly into the field that I'm currently in, which is diagnostic X-ray, but you can also use your associate's degree in interventional radiology, in CAT scan, and in MRI. They just would require additional on-the-job training as well as the individual registries for CT and MRI that you would have to take in order to become credentialed, on top of the registry you'll take in X-ray school to get your X-ray credentials. Currently, there is no advantage to having a bachelor's degree over an associate's degree in diagnostic X-ray. Where that would come into play is if somewhere down the line you wanted to go out for a team lead position or a managerial position, those are jobs that require a bachelor's degree. Also, if you're ever interested in teaching X-ray courses at a university level, you would also need a bachelor's degree for that. My employer, along with many other hospitals, do offer tuition reimbursement to help with going back to school and furthering your education. So I'm currently going back to school for my bachelor's in healthcare administration to hopefully give myself more opportunities in the future. The best advice that I could give to any student starting out in the medical imaging program would just be to always make sure you're giving yourself enough time to study. There's going to be so much information that you need to learn that's going to continually build off itself as the program progresses. So use your note cards, make study groups with your classmates, and make sure to bounce ideas off family and friends to really help that information stick. As far as your clinical rotations are concerned, just treat every single day like it's a job interview. So when you're at your hospital site, be on your best behavior, show everybody dignity and respect, always dress the part, be on time, and eventually your hard work will pay off. The technologists will notice this, the managers and leadership will notice this, and all that may pay off down the road when it's time to graduate and you're looking for a job. One skill that can be learned outside of the classroom that's very important in medical imaging is definitely customer service. Not only will you be dealing with a very diverse patient population with people of all different backgrounds, you'll also be dealing with a lot of other people that work at the hospital, such as nurses and doctors. And having good communication really makes teamwork possible and makes better patient care. So when you're out working in the field, not only are you representing yourself, you're also representing your department as well as your entire hospital. So providing good patient care, being attentive to the patient's needs and answering any questions they may have. You're also, talking with those other departments and working together to keep everything running smoothly. So I, for example, worked in food service before ever working in a hospital, and dealing with customers, whether it was on the phone or the cash register, I use those experiences in the hospital today to continue to just communicate well and just to make sure that I'm always putting my best foot forward. Back when I was looking to get into the medical imaging program, there actually was no HESI test. It was a placement test called the Hobbit. I'm sure that most of the competencies are fairly similar between the two tests. It's just a bit of a different format since I took mine. The best advice that I can give is really hone in on the categories that they'll use for placement. And if you are able to at all, I highly suggest getting either an online or a physical study guide, anything that will allow you to study the material that'll be presented, as well as taking practice tests is always one of the best things that you can do so that you can get a feel for what might be asked and the time limit and how long it's going to feel like when you're actually taking that exam. When the time comes to pick your clinical locations, you'll be given a hospital that'll sort of act as your home base where you will spend the majority of your clinical hours as you progress throughout the program. There will be opportunities to rotate to some other sites. For example, I was at Riverside Methodist Hospital as my home hospital, but I also went to Children's Hospital as well as the VA. And it was great just to kind of work with different populations and kind of get a feel for how things are done at different sites. You will also have a chance to go to other sites if there is exams or competencies that aren't as frequent at the site that you're at. You may be moved around just in order to get all of those done, so you'll be able to get your credentials once you graduate. The best things about my job in diagnostic X-ray is that it's never boring. Working at a place like Riverside Hospital, it's very big and very busy, so there's really never a dull moment. At a site like that, you're really going to use all the education that you learned throughout your medical imaging program, and you're going to kind of use that on a daily basis. So they try not to keep us in the same spot too often, so we really tend to rotate around to all the different departments we have. So, some days you'll be up in surgery using our equipment. You might be in the ER working with trauma patients. You may have a shift where you're doing portable X-rays and taking our machine up to patients' rooms that can't travel. Or you might be in the fluoroscopy department helping assess swallowing function for a patient or assisting a radiologist in a procedure like a pain injection in a joint. So there's a lot to do, and you're really constantly always moving. So I really appreciate that about the job, and it really makes me value the education that I got to get me where I'm at. The positions at my hospital are split up into 3 shifts. There is mornings, evenings, and nights. There might be a little bit of crossover depending on which hours that you work. Those shifts are broken down into 8-hour, 10-hour, and 12-hour shifts. I currently am a first shift worker, and I work 8-hour shifts, and that's always consistent for me. If you were to work some of the 10 or 12-hour shifts, since you are working more hours per day, usually that is going to allow you to have more days off during the week, which can be nice. Also, if you were to work the evening or night shift position, there is a pay differential, which can make it a little more lucrative to seek those shifts out. There's a lot of flexibility in the healthcare field, so if it ever comes down to if you have a major life change, if you decide to go back to school or decide to start a family, you may desire to change your shift. So there's a lot out there. You just have to wait for one to become available that's really going to suit you and suit your future plans best. Most hospitals do use a contingent pool as well, which can be a nice alternative to full-time work. So in our case, we use contingents to fill open shifts. If somebody might be taking a vacation or if they're going to have an extended absence, we have a pool of workers that we can post those hours out to. And then they can pick them up at their leisure, and it's sort of nice to be able to make your own schedule however you see fit. It is not always consistent, and there may be more hours at certain times of the years or at certain hospitals depending on their staffing levels, but there is alternatives to full-time work, so the contingent pool is a great way to get your foot in the door and, again, to be able to sort of make your own schedule as you see fit. My absolute favorite thing about diagnostic X-ray is definitely the critical thinking that is involved. That's definitely something that drew me to the profession in the first place, and it's something that I have to use every single day when I'm on the job. So very rarely are you going to have a patient or a scenario that's exactly how you learned it in the textbook. So you have to always use that base knowledge that you have, and then you sort of have to adapt to the situation at hand. So if that patient can't exactly move exactly how you need them to or get in the correct position, you may have to use things like angling sponges. You may have to utilize tape to hold certain things in place. You may have to angle your X-ray tube in a certain way to simulate body movement. So you're consistently, thinking of all the most creative ways you can possibly get these exams done, but still provide adequate patient care, do it in a safe manner, but then also get the X-rays that you need to send off to the radiologist so they're able to get good diagnostic quality and help those patients with their ailments and to help get them better. There's no sugarcoating the fact that diagnostic X-ray can definitely be a very labor-intensive job. At a big site like where I'm at, I'm constantly on my feet. I'm always moving patients from their beds. I'm helping position them for their X-rays. And I'm also moving some of our big equipment from point A to point B. The nice thing is I do have a very large staff that I work with, so usually my coworkers are just a short call away if I need help moving somebody or if I need a second piece of equipment. They're usually right there to help. So it's definitely nothing that should dissuade you from seeking a medical imaging degree or getting into diagnostic X-ray. Some of the other modalities like CT and MRI, they're still going to have they're still going to run into the issue of moving patients and shifting patients and stuff, but there might be a little less positioning and less equipment that they need to haul around. So there might be a little less, they might be a little less labor intensive if that's what you're looking for, and maybe that's something that you could move into once you get your medical imaging degree. As I discussed in my previous answer, again, probably the most difficult thing about my job is how physically demanding it can be at times. Again, it's a small difficult aspect, but there's so much more to love about the job that really doesn't deter me as I go about my business every day and working hard. Within diagnostic X-ray and especially in interventional radiology, these are two of the jobs that do carry the highest risk of exposure to radiation. But there's a lot of things that are in place to sort of mitigate that risk and to, perform our job as safely as possible. So in my job in diagnostic X-ray, generally if we're taking just a plain film X-ray, we're usually behind lead glass, behind a control panel, and we're out of the room when we take those X-rays. So that, cuts a lot of the dose out right there. But there is times where you're going to be in the room where an exposure is going to take place, especially in fluoroscopy and also in surgery. They both have units that emit radiation to acquire the imaging, and you will be in the room when that happens. So we do our best to maintain distance away from any machine that is emitting radiation, as well as wearing lead shields. We have thyroid shields, as well as lead glasses available to cover any of our radiosensitive organs. And also, I don't have it on right now, but we usually have a radiation badge that picks up any radiation dosage that we do receive in any of those exams where we are in the room. And those are usually broken up by quarters, and we get those numbers back. And even at a big site like where I'm at Riverside, where we get on average a higher dose than maybe, say, a small hospital or an urgent care, even with getting that higher dose on average, my numbers have always come back very low. And again, I've just always taken every precaution that I can to keep those numbers low. So if your badge ever came back with a high reading, leadership could get involved, and there would be intervention that could take place to kind of figure out why your dose is high that quarter, or try to figure out how we could mitigate that in the future from happening. So the risk of getting the exposure is high, but the dose itself is generally low. So if you were interested in a medical imaging job that required no radiation at all, MRI is a great field. They have no radiation whatsoever, and if radiation is a concern to you, that would be something to look into. MRI might be the job for you, and upon graduating, you might be able to be hired on in one of those departments. So keep that in mind. The ARRT registry for medical imaging is definitely no joke. It is a 200 question test that I think you have about 3.5 hours to complete. And it's going to cover all the topics that you will have learned throughout your entire time in the medical imaging program. So, I've always heard that it kind of translates pretty well, depending on, how well you did grade-wise in your classes. So an A student should score around a 90 on the registry. A B student should score an 80%, so on and so forth. That's usually a good indication of where you're at, depending on what grades you get. So keep that in mind. And then, anytime that you can make study groups with your classmates, that's going to be beneficial. If you're able to take mock registries, not only in class, but if you can take them on your own as well, that really helped me to actually be able to take mock registries that were 200 questions that actually had the 3-hour duration on them, so I could get a feel for what is actually going to feel like when I'm sitting in that room doing that registry at the time. Will I have a good concept of what 1 hour, 2 hour, 3 hours actually is? So mock registries were great, and that'll also kind of let you know where your weak points or your strong points are, so you know where to shift your focus. Also, if you get the chance to, I was part of Quiz Bowl at Columbus State, so it's basically at the OSRT meetings that they have. They do a Quiz Bowl where you have a team that is going to buzz in, basically a quiz type show, and it's all going to be centered around topics that are most likely going to show up on your registry. So by just participating and practicing with the team, or actually being a part of the team, that's going to increase your knowledge base even more and get some of those terms and stuff stuck in your head. I know that definitely was one of the biggest helps for me. So study hard for it. It's nothing that you can't accomplish, but I wouldn't take the registry lightly by any means. If you are interested in using your degree in medical imaging to go directly into VIR upon graduation, the best advice that I would give to any student currently in the program is use all the rotations that you'll have through VIR to your advantage. While I was at Columbus State, we got a chance to rotate through VIR, through CT, and also MRI. And that was great for us to kind of get a look at what those jobs have to offer, what they do on a daily basis, and kind of what the job entails. So again, if you're interested in VIR specifically, use that rotation, show up super motivated to learn as much as you can, about the techs, about the doctors, the nurses up there, get to know them, and ask as many questions relating to the job as you can. And the more motivated you are, the better impression that's going to make on them. So upon graduation, if they have jobs open and they remember you from your rotation, that's just going to be the icing on the cake. So as always, treat that like a job interview, and just like every other day on your clinical shift, and that'll definitely pay dividends later on down the road. I did all of my clinical hours at Riverside Hospital, and I was very fortunate to get a full-time first shift X-ray job there upon graduation. So as I had mentioned earlier, it's so important to treat your clinicals basically like a 2-year-long job interview. So, it's why you always want to be on your best behavior, to show up on time, to be interested, to ask questions. I always made sure that, I got to know all the techs that I worked with, that I got to know leadership. I consistently went to them and told them, hey, I would love to work here when I graduate. What do I need to do around here to prove that? What are you looking for? So just make sure that people know who you are, be active, work hard, get your work done on time. And if you're getting ready to graduate and there is a job available, then they're gonna remember you, and they're gonna remember all that hard work that you put in. So just keep it up, and just treat it like a 2-year-long job interview. To wrap things up, I could honestly talk about my job in X-ray all day long and tell you about all the amazing things that I love about it. But in general, if you enjoy a challenge, if you enjoy critical thinking, if you enjoy being active in your job, if you enjoy kind of the camaraderie of the hospital and all the little departments that are working together, if you enjoy really taking care of people that are not going to be in the best place ever, that are sick, that are hurting. If you enjoy patient care, being around people, hearing people's stories, it's a great job, and I've gotten so much fulfillment from it. And furthermore, just the medical imaging degree in general is just such a versatile degree. There's so many different job opportunities that can come from getting it. Diagnostic X-ray is a great starting point, but as I mentioned earlier, it opens doors to VIR, to CT, to MRI. There's a lot of different avenues that you can go into, and if you wish to build upon that associate's degree with a bachelor's in the future, then there's even more opportunity beyond what I've mentioned. So it's the medical imaging program at Columbus State is great. I had a great experience there, and it really helped propel me into the position that I'm in now, and I couldn't be happier. So thank you so much for listening to the answers that I provided. And I hope that I was able to help some of you to either learn more about, what I do for a living and learn more about the career field, and help you make a decision about possibly picking a major. Thanks again.
Thank you for watching this Meet the Mentor session. If you do happen to have more questions about the profession, the career mentorship program, exploration programs, your resume, cover letter, choosing a major, interview prep, anything you need, feel free to give our office a call at 614-287-2782 or chat live with a career counselor at www.cscc.edu/career. Thank you.